Have you ever felt that burning, nagging pain in your stomach? Maybe after a meal, maybe in the middle of the night, like something is literally eating away inside? It's not just dramatic imagery. That sensation might be your body's way of saying, hey, I could have a stomach ulcer. Today, we're diving deeper than your last late-night snack, into what really causes stomach ulcers, also called gastric or peptic ulcers. We'll bust myths, uncover sneaky bacteria, talk about everyday habits that can put your stomach at risk, and explore how doctors figure all this out. By the end, you'll know exactly what's happening inside that hard-working digestive machine of yours, and how to protect it. So settle in. Maybe grab a soothing chamomile tea, skip the extra hot sauce for now, and let's explore what's really going on inside your gut. Before we talk about ulcers, let's appreciate the stomach for a second. It's a muscular, stretchy sac about the size of 2 fists. Its job? Break down food with strong acid and enzymes so your body can absorb nutrients. That acid, hydrochloric acid, is powerful enough to dissolve metal shavings in a lab. Seriously. If you poured it on a coin, you'd watch it fizz. But you're obviously not melting from the inside, right? That's because your stomach has an incredible defense system. A thick mucus layer coating the inside. Special cells that constantly repair the lining. A steady supply of blood to help with healing. A stomach ulcer, also known as a peptic ulcer if it's in the small intestine, is an open sore that forms when something disrupts these defenses. Imagine scraping the paint off a car and then pouring acid on the exposed metal. That's what happens when the lining weakens and stomach acid hits the tissue beneath. Decades ago, doctors blamed ulcers on stress and spicy food. You're working too hard. You're eating too many hot peppers, they said. But in the 1980s, 2 Australian scientists, Barry Marshall and Robin Warren, shattered that belief. They discovered a corkscrew-shaped bacterium called Helicobacter pylori, or H. pylori. Here's the wild part. H. pylori can survive stomach acid. How? It burrows into the protective mucus and produces enzymes that neutralize acid around it, basically creating a cozy bunker. Over time, it inflames the lining and leaves patches vulnerable to acid damage. When these scientists first presented their findings, the medical community laughed. So Dr. Marshall did something shocking. He drank a culture of H. pylori to prove it caused gastritis. Within days, he was sick, and eventually, he and Warren won the Nobel Prize for proving bacteria could cause ulcers. Science is wild, isn't it? Today, we know H. pylori is the #1 cause of stomach ulcers worldwide, infecting over 4 billion people. Most never feel it, but for some, it's the start of serious trouble. H. pylori isn't the only villain. The other major culprit is a class of everyday medications called NSAIDs, that's non-steroidal anti-inflammatory drugs, like ibuprofen, naproxen, and even aspirin. Here's how it works. NSAIDs block certain enzymes to reduce pain and inflammation. But those same enzymes also help protect your stomach lining by encouraging mucus production. Take too many NSAIDs, or take them on an empty stomach, and your protective layer thins. Acid sneaks in. Ulcers form. Even low-dose aspirin used to protect the heart can increase risk if used long-term without precautions. What about lifestyle? Well, stress doesn't directly cause ulcers, but it can crank up stomach acid and slow healing. Smoking is another double whammy. It reduces blood flow to the stomach lining and makes H. pylori infections harder to treat. And yes, spicy foods? They don't cause ulcers, but if you already have one, they can feel like throwing chili powder on an open cut. Not pleasant. So how do you know if you might have a stomach ulcer? Here are the big red flags. A burning or gnawing pain in your upper abdomen, often between meals or at night. Pain that briefly improves when you eat, then comes back. Nausea, bloating, or frequent belching. Unexplained weight loss. If the ulcer bleeds, you might see dark, tarry stools or vomit that looks like coffee grounds. Those are signs of bleeding and a reason to seek emergency care immediately. Remember, not everyone feels severe pain. Some people only find out after complication like bleeding or perforation, when the ulcer literally creates a hole in the stomach wall. That's life-threatening and needs surgery fast. Okay, so you're having that burning stomach pain and you're wondering, is this really an ulcer? Doctors have several smart ways to figure it out, and it usually starts with a good conversation. They'll ask about your symptoms, when the pain happens, what makes it better or worse, what medications you take, and even your stress levels or smoking habits. Don't be shy or embarrassed. Those details can be the very clues that point them toward the right test. After that, the detective work begins. Here are the main tools in the ulcer diagnosis toolkit. 1. The breath test. You drink a harmless liquid containing a special compound, often urea labeled with a tiny marker. If H. pylori bacteria are hiding in your stomach, they break down that liquid and release carbon dioxide that shows up in your breath. It's painless, quick, and almost feels like a science experiment. You literally breathe into a bag and the lab does the rest. 2. Stool antigen test. Another non-invasive option is a stool test. It looks for proteins, called antigens, that come from H. pylori. Doctors like this one because it not only detects the infection but can also confirm that treatment worked weeks later. Not glamorous, but incredibly accurate. 3. Blood test. A simple blood draw can check for antibodies against H. pylori. This one is less common now, because it can't tell if the infection is current or just something you had in the past, but it's still useful in certain cases or when other tests aren't available. 4. Endoscopy. This is the gold standard when a doctor really needs to see what's happening. You'll usually get a mild sedative to help you relax. Then a thin, flexible tube with a tiny camera, called an endoscope, slides gently down your throat into the stomach. It lets the doctor look directly at the lining, spot ulcers, check their size, and even take a biopsy, a tiny tissue sample, to test for H. pylori or rule out anything more serious. It sounds intimidating, but most people barely remember the procedure afterward, and it gives a crystal clear picture. 5. Imaging, when needed. If there's concern about complications, like a perforation or blockage, doctors may also order imaging, such as an upper GI series with barium or a CT scan, to see the shape and motion of your digestive tract. Sometimes a combination of these tests is used. For example, you might start with a breath test and then, if symptoms persist or bleeding is suspected, move on to an endoscopy. The bottom line? Diagnosing an ulcer today is far more precise and far less scary than most people imagine. In a single visit, your healthcare team can usually pinpoint the problem and map out a treatment plan that puts you on the path to healing. If H. pylori is the culprit, doctors prescribe a combination of 2 antibiotics plus an acid-reducing medication, often called triple therapy, for about 2 weeks. For NSAID-related ulcers, the first step is usually stopping or reducing the medication and adding acid blockers like proton pump inhibitors, PPIs. Healing usually takes a few weeks, but the relief can feel almost immediate once treatment starts. During recovery, doctors might recommend avoiding alcohol, quitting smoking, and steering clear of foods that trigger pain, like super acidic or very spicy meals. Want to avoid ulcers in the first place? Here are practical tips. Wash your hands and food. H. pylori can spread through contaminated food or water. Use painkillers wisely. If you need long-term NSAIDs, ask your doctor about protective medications. Eat balanced meals with fiber-rich fruits and vegetables. Some studies show foods like broccoli sprouts, garlic, and green tea may help fight H. pylori naturally. Manage stress with exercise, meditation, or just a daily walk. And here's a myth buster: drinking milk won't heal an ulcer. It might feel soothing at first, but it actually triggers more acid later. Grandma meant well, but science disagrees. So, to recap, stomach ulcers aren't just about stress or fiery food. Most come from a sneaky bacterium or common painkillers quietly damaging the stomach lining. If you ever have persistent stomach pain or see signs of bleeding, don't ignore it. A simple test and the right treatment can make a world of difference. Thanks for spending this time with me. If you learned something new, give this video a thumbs up, hit subscribe for more science-backed health tips, and share it with anyone who still thinks ulcers come from too much hot sauce. Take care of your stomach. It works hard for you every single day. Treat it well, and it'll return the favor.